Hello, Extempers, speech innovators, and everybody else listening to this podcast episode. I hope you're ready for this wild ride of an episode. I mean, it's not that wild, but it is something that we've been meaning to cover, but haven't gotten around to covering it because a lot of other things have happened that we're in the moment, and we kind of just made some executive decisions. So honestly, everybody, I hope you're prepared to listen to this episode on monkeypox, which is long overdue because it's been happening since May. So we apologize, but it's here now. And you're probably going to get an Extemp question on it when the season starts. And it's probably something that's easier to understand for those novices that are listening to this episode right now.
Anyway, I'm Spencer, that's YuYu, and we're going to talk about monkeypox. And it's really not that thrilling of a story, but we need to talk about it anyway. So that's important. Just to give you the roadmap of the episode, as we always do, we're going to start with some housekeeping. There is actually something that I'll bring up with housekeeping. Then we'll do some background information, some possible questions. We find them on Extemp Central, and then the show will end. Really quick with housekeeping. So we recorded this the day after the Queen's death. We will be having a pretty big episode on Britain next week. I think that's what we've decided on, right, YuYu? So we're gonna cover that. There's a lot that's happened. We do understand that there's now a king, there's a new prime minister, it's a lot. That's a very political episode, very important on how the UK's political system works. It's very complex. So there's a lot to be talked about. We're going to save that till next week. That one might be a little dense on my end. So that's just kind of a fair warning, because I do know how UK's government works. And it's kind of complicated. So we'll have the big episode next week. I think I've decided that I'm going to call it State of Britain, which is perfect because it's like the State of the Union, you know. That's so funny.
Or we can name it London Bridge is Falling Down. But that's just my suggestion.
Yeah, Operation London Bridge. Anyway.
Oh, God. Anyway, let's get on to this episode, because this is an episode about monkeypox and not the United Kingdom. So we'll save that for next week, and I hope you're excited and you should stay tuned.
Yes. Other than that, this should be a short episode, so we'll be quick. A quick edit from the beginning. But anyway, let's get into this. So what is monkeypox? Well, simply put, monkeypox is a disease that is caused by the monkeypox virus. Helpful, right? It comes right from the CDC itself. However, it is quite rare. The disease is in the same family as the smallpox virus, but not that of the chickenpox virus. They are different. Monkeypox just has a bit more milder symptoms than that of its counterpart, smallpox. The first note of monkeypox was in 1958, when researchers found a pox-like outbreak with monkeys. While this was the first instance of it, we never knew really when it originated or where it originated. I guess from what we understand, it's probably originated a little bit before then. The first time monkeypox was detected in a human was in 1970. But up until the 2022 outbreak, monkeypox was not really reported outside of Central and Western African countries. Normally, cases of monkeypox that happened outside of these countries were linked to international travel. With that said, it's important to gather some data as to how many cases of monkeypox are right now across the globe. There have been 57,527 reported cases of monkeypox as of September 9th. Nearly all of those have been in places in which monkeypox has never been reported before. Only 511 of those cases have been in countries that have reported monkeypox before. And to note those on the same lines, there have been 103 countries with a reported case of monkeypox, and only 7 of those have reported the infectious disease once before. Like I said, short background, but monkeypox has also only had 18 deaths worldwide. Out of those 18 deaths, it has been split pretty evenly to countries that have reported monkeypox and countries that haven't, with eight deaths in countries that have not reported monkeypox and 10 deaths in countries that have reported monkeypox. So essentially, this shows that monkeypox is not too fatal, but it is something to be worried about considering that it does have over 50,000 cases worldwide. Like I said, probably one of the shortest background segments I've ever had on this show. But that simply is what monkeypox is. It seems to not be really researched a lot. I guess there's probably been a good amount that's been researched with it, but this kind of outbreak has really never happened before. It's usually just contained in the Central and Western African countries. So now that it's kind of been reported outside of it and not necessarily linked to international travel, that's one of the reasons why it's kind of a big deal right now.
Yeah, and I guess what we're trying to convey here is that monkeypox has happened in the past and has already been researched. And what we know is that it was only contained in the Central African areas. And also, we already have a vaccine for it. It's just what is so controversial or what made people panic about it is what I'll be covering in this next section. So like Spencer's, I think mine is going to be either a little short or me stalling for time. But either way, the information is going to be important. So let's get to it. Monkeypox has been declared an international public health emergency by the World Health Organization and a national public health emergency by the US government. There have been about 22,000 cases of monkeypox reported in the United States by the CDC, and the states that have it worse are states like California, New York, and Florida, with cases ranging between 4,000 on the high end and 2,000 on the low end. There are now 2 deaths in the US that have been associated with monkeypox, but have not yet confirmed that it was a death directly related to monkeypox. Just the people who did die had monkeypox at the time. But what has the US been doing, and what do people think / what does the whole world think, and how has our global response been? Well, in the US, monkeypox taking us by surprise is another reminder of how our healthcare system is not as equipped to deal with viral or general disease outbreaks. Similar to how COVID was handled, there were limited testing being done initially, and the vaccine for monkeypox didn't come to the US until 6 weeks after the first cases were reported. And that was only because they were being manufactured in Denmark and waiting for the FDA to approve the manufacturing plant before they could be made and shipped to the US. However, President Biden was able to get enough distribution of the vaccine around the US, but there is still a disparity in distribution of the vaccine to groups of people. It's been reported that while white men have seen a decline in infections, Black men are now 38% of the infected population, and Latino men are about a third of the infected population, which combined is over half of the total infected population. This just shows that while vaccine distribution and supplies are up, they're not effectively being distributed to every community that's in need, especially the ones that are most in need. There hasn't been a big of a panic to the monkeypox vaccine, however, when compared to the panic associated with COVID. Globally, monkeypox was such an alarming issue because it was both right after COVID was starting to simmer down, and also because it seemed to spread pretty rapidly when monkeypox outbreaks were reported to be limited to Central and Western Africa, like Spencer had mentioned. It has been reported in about 90 countries now, which is a big concern and why it was declared a public health emergency globally. The main problem with the global response to monkeypox is that the distribution of vaccines between countries was a main problem. So there's only one monkeypox vaccine distributor, and that's Denmark's Bavarian Nordic. The UN and the WHO have stated that there needs to be solidarity in vaccine sharing when it comes to containing the outbreak, but that has yet to be seen. So while countries like Britain and the US has been asking for millions of vaccines for monkeypox and receiving the monkeypox vaccines, it hasn't been an equitable distribution between all of the countries that are involved. For example, Africa has not been receiving the amount of vaccines it needs to prevent the disease from spreading there and potentially to other countries from there, according to Dr. Mabala, a virologist who directs the Global Health Department at Congo's Institute of National Biomedical Research. Again, this is another indication that it's not only national response to diseases that needs help, but global response to containing diseases also needs work too, because there has been these disparities globally seen and also disparities within the US between communities as well. So when evaluating where monkeypox is now, it's really hard to see where exactly it'll fizzle out and kind of die. People think it's going to be endemic, where cases are still going to exist within these countries without any traveling between countries. That would be the main reason that spreads the disease. So we'll see what happens with monkeypox, but it is starting to decline and kind of phase out a little bit now because of vaccine distribution and also because there hasn't been as many fatalities.
Yeah. And all this discussion makes for the easy Extemp question. Will monkeypox become the next pandemic? The next global pandemic? So, YuYu, we'll give you the privilege. Go ahead and start here.
Oh, thank you, Spencer. Honestly, I think Spencer and I can both agree that it's not going to be the next global pandemic, both because there is a vaccine for it. There has been at least some global distribution of the vaccine to prevent the outbreak from getting any worse, and there's not a lot of fatalities associated with this disease. So while it is a public health emergency, it's not necessarily the next global pandemic because it's not as wide of a scale as COVID was. I think you can even read like on WHO's website and the CDC's website, like what makes a global pandemic, and monkeypox just doesn't have the same criteria of, I guess not the same criteria, but like hasn't met the same criteria that is needed to be declared a global pandemic. I think it's only just been endemic is what people have been calling it. So other than that though, you can also say that monkeypox is not the next global pandemic because again, most countries have started to get it under control, and it's also not that big of a deal in countries who have like monkeypox. There is some panic in the states or in the places where monkeypox cases have been increasing and have like a lot of monkeypox cases. However, it's not something that a lot of people are panicking over where they're scared it's going to be kind of like their death sentence.
Yeah, I am gonna agree with that a lot. I will give you a yes answer just because it's kind of the point here. I think you could make an argument that it does become it at some point. And kind of one of the things we were talking about when we determined this episode was kind of coming up with this question. This makes sense if you look at how long it took COVID to become a global pandemic and kind of the scale it was, because it's in the same time frame at this point. Both of these issues have they both have lasted about the same amount of time before they hit pandemic status, right? And while I don't think it's as many cases as it was with COVID, it's kind of in tandem, right? You have it in the same, they're in the same lines. And essentially what's going on with monkeypox can be argued as, look, this is likely to become another pandemic that happens because of its similarities and trends with how long it's been around and how many countries it has gone to, right? So there is a fair argument for yes. I think the evidence and kind of what our discussion is going to be is it's more strong no right now. It doesn't seem like it's like a big threat. Fatalities are really low. 18 deaths out of 57,000 is kind of ridiculous. Like most people are going to be fine if they get it, right? It's just if you get it, you should go to a doctor and say, hey, look at this. It looks like hives. And they'd be like, oh, yeah, that's monkeypox because it's going to look more like hives, right? That's something we didn't cover. But That's kind of the way it looks. It's a good example of what you might expect it to look like. It's similar to that kind of disease or that kind of not an infection, a rash. So really kind of just important to understand, right, is, I mean, the amount of deaths are going to be really low. And admittedly, I don't really think it's something to be scared about. I do think that as this continues, that we will definitely see more of those disparities in deaths in African region countries. That's kind of where that's where this all really started, right? Like those Central and Western African countries where we've had cases of these before. I kind of anticipate that that's going to exist here again. It just hasn't gotten to that level. And it's something to be kind of relatively concerned about what are we going to do with that, and should maybe the United States take a role in dealing with that. And maybe that's the question that we should be anticipating, or you should be anticipating a little bit more, is what should be the role of the US internationally with monkeypox vaccines, right? Because I would maybe make an anticipation, because anticipation is my favorite word today, that monkeypox deaths would probably be more relevant and occur more in African countries. Maybe that's a bad guess, but my understanding of kind of like, I mean, they don't really have the distribution to do this, and that is a fair argument. Their governments need to be able to. Their governments don't really have the best ability to protect the health of their people all the time. But you can correct me if I'm wrong.
I think, like, with that being said, we do want to stress that we are not health experts. We don't have a PhD in medicine, and we don't study this for a living. So definitely consult sources like the CDC and the WHO to get information about this disease, and also information about its spread. Another thing that we should probably stress to you, probably should have put it at the beginning of the episode, but it's fine, is that, like, even though this has been coined like monkeypox and it seems to originate from Western and Central Africa, this does not mean that it is like Western and Central Africa's fault for spreading monkeypox to other countries. We don't know necessarily what, like, the cause is, and I guess also it shouldn't be like the main focus. The main focus should be on containing the spread and being able to recognize whenever you have been infected, so that you can keep yourself safe and also keep others safe too. This is not blaming people. This is not like, oh, you started it, you got to fix it. It's more of like, we should recognize how our global response has been affected in terms of trying to deal with both COVID and also monkeypox, but also like how individual countries and their public health systems have been able to deal with these outbreaks, or not been able to deal with these outbreaks, and what we can do to fix that. So I guess that's something that we should also stress in this episode too.
Yeah, I agree. We should be focusing on containing the spread, and kind of your point right at the end was the point that I was making right a few moments ago, right? I mean, I don't think African countries have like that ability to do that or as effectively, right? I mean, we're not putting a blame on Central and Western Africa. But my point is, if anything, we're probably down in the future, that's going to be an issue for these countries. And I think the Extemp question that we might be more associated with is, what should the United States do in trying to help other countries with this, or how can these countries better handle this outbreak, right? And that could be reaching out to the US and seeing if we can be able to distribute, et cetera, right? But that's going to be really difficult for these countries to do that. And they just don't have the resources to be able to effectively distribute a vaccine to their population. And essentially what I do think will happen is we will probably, like I said, non-expert, probably should be looking at my sources a little bit better on this, but I would anticipate that in these countries, we would see a disparity in the amount of people that do die from this, right? But that's also just me thinking about that. Because considering that, I mean, right now there are more deaths in those reported countries, even though it's just 2. But reasonably speaking, like those are the countries that have reported these cases before, etc. So that's kind of what I anticipate, but maybe there's ways to better that. And maybe that's the better question to be asking.
And probably international health experts like Dr. Mabella is the people that should be answering those questions in terms of how we should do equitable vaccine distribution and containing disease outbreaks globally. So yeah, that's all we got for you. It's a pretty short episode.
It's the shortest episode of the podcast.
Honestly, like maybe it makes it a little bit more listenable, manageable. We know you're busy, but we don't know exactly what you're doing. So maybe we're just on in the background. And I hope either way you've gained some information from this. Hopefully your season goes well, and good luck to the novices starting out their first tournaments in like a couple months.
I know the whole season's starting. So like people are starting to get back in, and I'm seeing posts everywhere from speech and debate left and right. So if you guys are starting, good luck. Hopefully this is a helpful resource. We're going to really try to push this year.
Yeah. Let's see where we get. So with that being said, I hope you get the win of the round. If you don't, let us know how you did. Let us know how we did. If you have any questions, comments, or concerns, feel free to message me or Spencer at our social media. That's like linked somewhere on this video or in the description, or especially, I guess, in the description if you're listening on the pod. But be sure to follow us on social media at Instagram and Twitter, and our handle is at half hour Extemp podcast.
A half hour Extemp podcast, YuYu.
I know, it's late. Okay, at the Extemp half hour podcast. And also, if you're not subscribed to this YouTube channel, we highly, highly, highly encourage you to subscribe, and also ring the bell so that you are notified every time we post episodes. Our episodes post earlier on our YouTube channel than they do on the podcast. And also be sure to support the One Clap podcast too, because they're a great resource for speech and debate generally. We love this event, but we also love speech and debate in general, and I hope that you do too. So thank you so much for listening to this episode. I hope you will be excited for the next episode on the United Kingdom and future episodes. So see you later.
Thank you all so much for listening. It's been a short episode, but that's good. Thank you all so much for listening. Until next time, we'll see you all later.